If you want to know how your critically loved one in intensive care can be diagnosed for a heart attack, stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com, and I have another quick tip for families in intensive care. So here's some context. We are currently working with a client who has their 80-year-old mother in intensive care with stage 4 breast cancer. She's doing okay, given that she went into ICU with a pneumonia. She needed some antibiotic therapy, but she never had to be intubated or needed BiPAP or CPAP, which is really good. So she got out of ICU within 5 or 6 days. However, as she was going along in her ICU course, we found while we were reviewing the medical records that she had a high troponin in her blood results. Now, the troponin levels in the blood results indicate that someone has an acute heart attack or an acute MI, myocardial infarction. And I said to our client, has the ICU team spoken to you about your mom having a heart attack? And he said, they have not mentioned it with one single word. So then the client obviously asked, how is a heart attack being diagnosed in intensive care? That's pretty much what I'm answering today. So first off, it is diagnosed by checking a troponin level in the blood. And if troponin is high, then there's a high chance your loved one would have a heart attack. Now, but even leading up to a heart attack, how is a heart attack? What are the symptoms? It's usually shortness of breath, tachycardia, arrhythmias, but also chest pain, right? This patient wasn't ventilated at that particular point in time. She didn't complain about any chest pain, but that doesn't mean it wasn't a heart attack. It might have been a silent heart attack. In any case, so how do you diagnose a heart attack in intensive care? It really comes down to a combination of clinical assessments, ECG, cardiac biomarkers, i.e. troponin, imaging, and hemodynamic monitoring. Here's a more structured approach. Number one, clinical assessment. Symptoms. Patients in ICU may not always be able to communicate chest pain. So look for atypical signs such as sudden hypotension or shock. Hypotension means low blood pressure. New or worsening shortness of breath. Unexplained agitation, delirium, or confusion. Arrhythmias or hemodynamic instability. Risk factors are pre-existing conditions like coronary artery disease, diabetes, sepsis, or recent major surgery. None of that is the case with our client here. Next, ECG, also known as an electrocardiogram. Obtain the 12-lead ECG immediately and look for ST segment elevation. ST elevation in at least 2 contiguous leads. It's known as a STEMI, which means an ST segment elevation. It's a very specific medical term. Doctors and nurses in ICU would know what it means, but I'm just breaking it down here for you. Non-ST elevation MI is a non-STEMI or NSTEMI. ST depression, T wave inversion, or dynamic changes. At least now you know what you need to look for. Also in the 12-lead ECG, it might show a new left bundle branch block, LBBB, may indicate myocardial infarct in critically ill patients. Next, continuous ECG monitoring detects arrhythmias, ischemic changes, and ST segment trends. Number 3, cardiac biomarkers. Like I said, high sensitivity troponin, elevated levels with a rising or falling pattern indicate myocardial injury. CK-MB can be used, but is less specific and reliable than troponin levels. Serial measurements, repeat troponins every 3 to 6 hours to confirm trends. Echocardiogram, besides ultrasound, point-of-care echocardiogram identifies regional wall motion abnormalities, which suggests acute ischemia, right? So you will see in an ultrasound that the heart muscles are no longer, some parts of the heart muscles are no longer moving because there is ischemia, that there's dead heart muscle tissue from the heart attack. Next, rule out other causes of hemodynamic instability, such as pulmonary embolism, tamponade, or severe valvular disease. Next, hemodynamic monitoring, invasive monitoring Patients with a myocardial infarct may develop cardiogenic shock requiring arterial blood pressure monitoring, pulmonary artery catheters, if indicated, to assess cardiac output and filling pressures. Another term for pulmonary artery catheter is a Swan-Ganz catheter. Next, additional tests. Chest X-ray rules out other causes like pneumonia, pulmonary edema, or aortic dissection. Next, coronary angiography for high-risk patients or those with ongoing ischemia despite medical therapy. And check for a differential diagnosis, which need to be considered. Sepsis-related myocardial dysfunction, Takotsubo cardiomyopathy, pulmonary embolism, aortic dissection, electrolyte imbalances causing ECG changes such as hypo or hyperkalemia, and low magnesium and high magnesium. Immediate management if a heart attack is suspected. For STEMI, for an ST-elevated myocardial infarct, emergency reperfusion therapy, PCI or thrombolysis if PCI is unavailable. Non-STEMI, dual antiplatelet therapy, anticoagulation, beta blockers if stable, and risk stratification for early invasive strategy. And for the STEMI, if you wonder what is PCI, it's basically an angiogram or an angioplasty. So I hope that helps. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in critical care nursing. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can confidently, very confidently say that we have saved many lives for our clients in intensive care. I can also confidently say that our advice is absolutely life-changing, and you can verify all of that. Number one, that we have saved many lives for our clients in intensive care. And number two, that our advice is absolutely life-changing. You can verify that in our testimonial section at intensivecarehotline.com. And you can verify it in our intensivecarehotline.com podcast, where we have done some client interviews. And you can watch for yourself what our clients have said. Now, and you can join a growing number of clients that we are helping in intensive care. We have helped hundreds and hundreds of members and clients over the years, and you can join a growing number of clients to change your life for the better, and you change your critically ill loved one's life for the better, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. I also talk to doctors and nurses directly on your behalf, or with you, or on a 3-way call. And I ask all the questions that you have not even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care. You can become a member if you go to intensivecarehotline.com and click on the membership link, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, and influence. And if you like, and all of that you get at intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next and what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show. And you will get notification for the YouTube live if you are a subscriber to my email newsletter, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.